So mouth mapping is a term that we've coined at Smile House. And what it does is it encompasses our integrated approach to diagnostics, where we put together the four domains of aesthetics, the beauty of the smile, which only could be beautiful is if you also have the understanding of structure, which we understand through our scanners, our cone beam CBCTs, and our function also through our scanners and our digital workflow of how the jaw comes together, the bite, whether you're grinding, clenching your teeth, whether you have small arches through development and maybe have an airway problem, or also biology. Biology is our periodontal assessment, oral cancer examination, pH testing, salivary diagnostics, where we understand the microbiome of the mouth. You see, the microbiome is the second biggest of the body is the mouth. The largest is the gut, which is about 6-7 trillion bacteria, but the mouth is about 7-8 billion. And we now know that the mouth seeds the gut. So if the mouth has inflammation and these bacteria that are called pathogenic bacteria get into the other areas of the body, that sets up. And now we know 20 years later of research that these chronic inflammatory bacteria find its way into the brain of Alzheimer's patients, into the pancreas of pancreatic cancer, in the interstitial cells of leaky gut. And we know that the mouth seeds the gut with these pathogenic bacteria. So the mouth inflammation and any inflammation in the body starts to overwhelm our immune response, and that bacteria can find its way throughout the body, causing cardiovascular disease, causing diabetes, and all of these things. We call it a risk factor for these chronic inflammatory disease. And that's why we believe that if you have oral health, which is so preventative, with a top dental office, you can have great overall health. When dentistry and medicine works collaboratively, we can have great outcomes for our patient. So starting with mouth mapping, it's the diagnostic way to have this comprehensive view with our interdisciplinary specialists working together, all coming together to diagnose issues from simple to complex, to unpack it, to understand root causes, and come up with a treatment plan that is customized specifically for the patient. Using our digital workflow and our technicians, we can visualize where we want to go, both with aesthetics, both with these different softwares that allow us to see where we might want to move the teeth orthodontically, where we might want to replace the teeth prosthodontically, and with our periodontist colleagues. But it's so much better having everybody under one roof. For 20 years, I would refer to colleagues, and unfortunately, communication breaks down. But today, because of Smile House, we meet weekly, we work together shoulder to shoulder, and we're able to diagnose and treatment plan and care for our patients at a much higher level. I personally feel this is the future of dentistry, of this collaborative approach of specialists working together to enhance and improve the care and the beautiful smile for our patients.